Historic event taking place because it is the launch of the Nelson Mandela Children's Hospital in Parktown, Johannesburg. Leanne Manus is there, and we say a very good morning to her. Leanne, it's a very good morning to you.
Palesa, a very, very good morning to you and a very good morning to South Africa. What a historic day this truly is. I think you absolutely put that correct. Today sees the launch of the Nelson Mandela Children's Hospital, and it has been a long, long time in the waiting. In fact, 11 years to be exact. It's something that was dreamt of 11 years ago, and then this construction started about 2 years ago, and look at this. This is what is now here standing in Parktown in Johannesburg. It is a dream. It is something that is meant to better the lives of the children of South Africa and the children of the continent, and it is finally here with us, and it's absolutely wonderful to be a part of it. I can tell you that the excitement inside and around this precinct it's tangible, because I think everybody that didn't think that they would get to this phase has actually reached it, and they're almost pinching themselves to understand that this dream has become a reality. Well, before we chat to some of the individuals that have been behind this, that have been working tirelessly to raise the money to ensure that this hospital is opened to its patients, we're going to take a look inside of this hospital. I'm sure you're as excited as I am, because if you've been watching Morning Live and if you've been following the media, this has been something that's been spoken about for such a long time. So let's take you on a tour inside the facility so you can understand exactly what is going on there.
Doctor, so this is the cath lab. Can you explain to us what that means and about the equipment? Tell us more about that.
This is actually a hybrid theater. In other words, we've got it's a two-in-one type of operating room. It's one of the 8 operating rooms in our main theater block. It's a cath lab because we have a cath lab. Cath lab is where we do non-invasive procedures, where through a big vein, the doctor can actually go in and actually go and look at the heart, for example.
And what is the function of the television screen, or what kind of screen is this?
This is a monitor. So while the cath lab has been done, the doctor can actually see the images on the screen. In other words, he can see what he's doing, because the catheter he uses has a camera in front, and therefore the image can be seen on the screen. Therefore, he can see a very, very clear picture of where he is at that time, and he can do the procedure while he's actually looking at what he's doing.
And tell me, is it only the surgeons and the doctors and nurses in the theater that is able to see on the monitor, or can they share with other doctors from other hospitals?
The images from here can be shared all over the country as well as internationally. In other words, using technology these days, you can send these images to the main lecture theater in the hospital. Students don't have to come here to see the procedure. They can actually see the images, what the doctor is seeing through the lens or through the camera of the catheter. They can also see from that side. But you can also send images across the Atlantic overseas. Doctors, they can also see, they can talk, they can advise, they can ask questions. So it's a very, very interactive procedure.
And doctor, tell me, who are your partners? Will you be working with Red Cross Children's Hospital in Cape Town?
We will be working with a number of partners. Red Cross have been our partner since the beginning. We've learned a lot from Red Cross Children's Hospital. They have shared their policies with us. We've been to their hospital. They've been here to try and assist us to ensure that we can actually have a very good hospital. They'll remain our partners forever. And they will definitely look after the southern provinces of the country. This hospital will focus mainly on the northern provinces of the country. But we also have partners all over the world. This hospital was meant not just for South Africa, but also for the continent. Madiba saw a need for a children's hospital to help children of the continent, and therefore we have partners across the continent.
Tell us more about these machines, the round machines. What do they do?
So what we have here is actually a C-arm. It's basically an imaging equipment that's used intraoperatively. So if a doctor is doing an operation, for example, orthopedic operation, and wants to look that the bone is properly aligned, he can quickly take a look at the image while the patient is actually still in theater, and be assured that everything is fine before he closes the procedure. So basically, like any other X-ray, it's got a tube and it's got another side that receives the images so that you can actually take the film. So you can actually, it's a digital image which you actually see on the screen, and you can know exactly what's happening.
Tell us more about the training that the doctors have undergone to work at the hospital.
So in this hospital, we have doctors that are already trained as specialists. Okay, there are pediatricians who have super specialized in various areas. For example, we're in a cath lab now. Here we'll have pediatric cardiologists.
And doctor, how will the admission work? Will people just be able to walk in and say, I've got a sick child? How will that work?
This is actually a referral hospital. It's not a walk-in hospital. A mother cannot just come here with the child and say, my child is sick. We still want mothers to follow and caregivers to follow the referral system. They must still take their children to nearest primary healthcare center, from which they will be referred up the system until they reach us, if it's required to come to us. So in other words, we will only receive children that are referred to this hospital by other hospitals.
The Nelson Mandela Children's Hospital will be the second children's hospital in South Africa with state-of-the-art equipment. Vanya van der Juffer for Morning Live in Johannesburg.
Just to set the tone for this morning's broadcast, to show you exactly what is going on, what you can expect at the Nelson Mandela Children's Hospital and that state-of-the-art facility. I have to read something to you. While I was walking around inside of the hospital, obviously everything is new, everything smells like it's just been unwrapped from the plastic, so it's beautiful, it's clean, it's new, it's magnificent. But one thing that jumped out at me was this beautiful plaque that's on the wall, and it's kind of a commitment to everybody that does walk in there. And this is what it says. I'm just going to read you the last paragraph. I'll perhaps get through the rest of it as the broadcast gets underway. But this is the promise of the hospital. We built this place with a promise to keep a value that runs incredibly deep. Children of Africa, this is our prayer. Here you'll be showered with love and care. I absolutely love that. And does that not speak to our former president, Nelson Mandela, who exactly those words, love and care, almost symbolize exactly what he stood for, and his love for children, which is most important. Well, this journey has been a very long, a very difficult journey, and at time a journey that I imagine would have thought that it wasn't actually going to succeed. And the lady that has been driving this, and I think a very stressed out lady at times, is the Chief Executive Officer of the Nelson Mandela Children's Hospital, Sibongile Mkabela, who is here with us, and it must be such a happy day for you.
Leon, I can't believe I'm here. Yeah. I can't believe you and I are standing here and we have fulfilled our promise to Dada Nelson Mandela. Yeah. As an African, I feel like going to the grave and saying, Dada, it's done. Yeah.
And that's exactly what it's all about, because this was something that he felt so passionately about. Yeah. It was something that he wanted, he envisioned, he dreamt of, and here it is.
He dreamt of it because he could through it, he propels us to the future. He forces us to develop amazing capacity for research, for training of all kinds of child specialists. He forces us to look in the eyes of a child and heal the hearts and not refer to others and not send to Europe and not say America will do this. He does what President Mbeki called the African Renaissance. And this is the expression of that Renaissance, the rebirth of Africa. If you had left it to ourselves, what would it look like? Our children would be held and looked after in places like this. Yeah. Not only about one is about their care. We know when I admit a 5-year-old, I'm also taking care of a mother who's stressed out. Yeah. So many of our partners came to the party. Ronald McDonald House said for those mothers, we have an amazing hotel-like facility that will take care of that mother from Keiskamawuk, who's here in Johannesburg and has no place to stay. We need her. The child needs her. We accommodate her at this place. So it has heart, but it also has knowledge. It promises excellence in the delivery of the service, which means our research capability. We are connected to the university, as you can see, to ensure that we're working with clinicians at the university, with researchers, young researchers. I mean, a lot of young people, I must emphasize, have been part of this project. Mm-hmm. From the time we developed the logo and we went to the Vegas School of Advertising, through to our architectural designs, our every design at every stage, we have the voice of the child. And when you walk through the building, you're going to see our wallpapers. Our wallpapers are made out of children's drawings. Beautiful. And then made into into what they are. You must see some of the benches that come out of children's things. So there is the voice of the child as you walk through the place.
Yeah,
they talk
feel it. It's almost like it's been designed by children in a way. I mean, it has. I saw the bench you're talking about. The one is it's shaped like a dolphin. I've never seen anything like that. It was beautiful.
We had play sessions. We had with workshops with clinical psychologists and other educational psychologists with children. Some of them in hospitals and school, wherever they were. We had these workshops, and they were given briefs to do whatever they wanted to do. And we took what they did with their clay doughs and we created the benches you see, because they can relate in their mind's eye. They can see these things, and we made them real.
Yeah. Now, we talk about the fact that this is the launch of the hospital because this is, you've been raising funds and begging people. But what I'm loving about this is that 80% of the funds have come from South Africa. It's been, this has been the generosity of people that have seen the vision, that have believed in the vision, and companies that have come to the party, and this is it. So today is the official launch of, as we were saying, there's a door, there's a parking lot.
There's a parking lot. The last time we were here, there were tractors, there were, there were gandas around. There is no ganda here. There's a parking lot. There's an entrance. There's a door that we hustled, by the way. We hustled everybody. That door was going to cost us $1 million.
So you spoke the price down?
We had a Madiba price. For everything. For everything. I mean, talk to Mary Jane, our leader of fundraising. She says, okay, that's the cost. Fine. What's your discounted price? This is it. Okay, below that is the Madiba price.
Love it.
So we got everything at Madiba price. And as we did that, and we're able to do that, because South African companies believed. If they didn't believe in this, we wouldn't be here. So whatever is going on in South Africa, what this says is that South Africans are ready to rebirth themselves. Yeah. And for me, this amazing rebirth, I am so excited.
Yeah. I have to tell you that for a year that has been a very turbulent year, it's been a year that has got all of us a little bit worried, a little bit concerned. I mean, every morning we're waking up, we're hearing bad news. There are things that are they're bringing us down. But what I'm feeling is that we've hit December, we're ending the year, and things are actually great, because this is the epitome of what South Africa can do if they stand together.
This is what we are capable of doing. Mandela says we're not only capable of thinking about today, but we're capable of imagining the future. Yeah. This is an imagination of what the future would be like. But this is also saying to our children, we care and we know amongst you there is a next Mandela. Yeah. So we will treat each and every one of you as if we were given an opportunity to have another Mandela. So we're so excited about it. I love the research capabilities of this hospital. I like the fact that we're not only going to train for this facility, we're going to train for Southern Africa. Because wherever your child is in the subcontinent, we want them to be guaranteed the same sense of belonging, of feeling, of a place that really cares for them. We are, it's like I'm saying, this is the birth of our African Renaissance. Beautiful. We are rebirthing Africa. Leon, I don't know how many times I struggled with, but this is it's Center of Excellence. I said yes. It's tertiary, quaternary, very sick children. Yes. But don't we just need good primary health care? And I said, don't you know that poor people and African people also do get heart defects? Yeah. And they do get kidney failure. And it's important that we look after everything, because there's that glass ceiling that's been set. And the glass ceiling is, for so long as you're poor, it's primary health care for you. If you get something more complicated than that, then we allow you to die peacefully somewhere else. This is saying we are capable of removing the glass ceilings over poverty, of stretching out, and sky is the limit. And we are a charity. We started with nothing.
Exactly.
Absolutely,
and here you are.
Except you and me.
And that's
begging.
It. And begging.
And you, the loudest mouth, begging.
And we begged, and this is what's come out of
thank
it.
you to you.
Well, I'm going to give you a big hug. Congratulations. I'm so happy today.
You.
And we can't wait to the celebrations to kick off. Today, it's the launch of the Nelson Mandela Children's Hospital, and we're going to be here the whole morning, so there's a lot more of this. Thank you, Sibongile. Congratulations, and enjoy the day. Let's take a break. We've got a lot more after this. Do stay tuned.